Hi, I'd just like to say hello, and I'm going to introduce you to a new treatment we've got at Riverbanks called Ultherapy, which is a amazing new treatment which doesn't involve any needles, doesn't involve any injections, doesn't involve any blood, doesn't involve any foreign bodies being injected into your skin. But what it does do, and this is what's truly amazing, it causes 42% more collagen growth in your skin than anything else. Okay, so and this has been proven through scientific studies. So if you would like a treatment that causes new skin growth, okay, in your skin, which will therefore result in healthier looking skin, tighter skin, okay, firmer skin, more tone, more glow, then you should think of Ultherapy. Ultherapy uses ultrasound energy. What is ultrasound? Well, traditionally we have ultrasound for imaging, you know, to look at babies inside mummies' tummies, or to look, in a medical term, maybe to look at gallstones or anything under the skin or in the body that we're not really sure about. Okay? And we're trying to find its location. And that's because ultrasound can be used, and it's very harmless. It passes through the skin and it can give images and identify areas. Well, we use that capability of ultrasound in Ultherapy to locate the exact depth of tissue where we want to deliver some energy. But we also use ultrasound energy to heat the skin and also to tighten the collagen. And that's a slightly more powerful energy than is used just for imaging. So that's all from the same handpiece. And I'm just going to show you how that works. So what you can see here is an Ultherapy handpiece, and there's some gel on the end, you can see, just like when you have an ultrasound scan. And if I just do an image, what you'll see, I'm going to freeze that, what you'll see now on my screen, and I'm going to show that to you. What you can see, there we go, you can see here that it's actually taken a cross-section photo of my skin, and you can see the top layer there, where's my pen? The top layer there is the skin layer, and there's a little bit of ultrasound gel up there, okay? Then we have the dermis, the skin thickness, then we have the tissue just below the skin, which is ideal for where we want to target the energy, and then we have muscle and tendon. Right? And then we have the bone. Okay? So in this instance, where I'd want the energy to be delivered is in this layer here. So I would use a 1.5mm setting as opposed to a 4.5mm setting, which you can see here, which is down in the bone. That's too deep. Okay? To get the skin tightening, I would want to treat up here. All right? So I'll bring myself back in the picture. So really what we're trying to do here, when we're treating the face, we're going to treat this is a mid to lower face setting, and we can see we're going to deliver 60 lines here, 60 lines there, 25 here, 20 and 15 here, okay, and 30 in the chin. Then with the next setting, we're going to deliver, hasn't come up because I haven't put the head on, there'll be another set of energy lines in the mid face, and then again for the upper face as well. All right. So each treatment delivers on average about 500 lines or so. Sometimes we need more if the person has a slightly bigger face, or if there's a little bit more skin tightening required. And that's why each treatment generally is customized for each patient, and the cost of the treatment is varied for each patient. The whole purpose of this treatment is to deliver energy at the precise depth. So ultrasound energy at the precise depth. What it does, ultrasound goes through the skin, it doesn't touch the skin. This is very different to lasers or radiofrequency. Lasers actually burn their way through the surface of the skin to cause new skin growth. And they work at the top layer, right at the top layer of the skin. They don't penetrate deep below the skin, unlike Ultherapy. So lasers will traditionally cause some temporary damage to the skin, but will cause fantastic skin tightening on the top layer of the skin only. Okay? They're great for sun damage, their lasers are great for acne scars, lasers are great for pigmentation issues as well, or for the thin, crepey skin. Radiofrequency, what that does, that generally heats the whole area of tissue, and ideally you want the collagen to be about 42 degrees, and that's at the deep layer. Therefore, you have to heat the surface of the skin to about 60 odd degrees, and that makes it quite painful. It's not very specific. It generally heats the whole area rather than the specific areas you want to treat. Okay? Ultrasound or Ultherapy, what that treats is you bypass the skin, so the skin's not touched at all with this energy, and you target in the depth, like I showed on the lines here, either at 4.5 millimeters below the skin, or at 3 millimeters below the skin, or at 1.5 millimeters below the skin. Okay? We can choose how deep we go depending on how thick your skin is, how thick your tissues are, and that will vary on different parts of your face. Most people typically use a 3 and a 4.5 for a lower facelift, for example. The treatment itself, you will feel some discomfort, but no worse than a Botox or filler injection treatment. Some people are more sensitive than others, but I've had this treatment as well, and I managed to get by a whole hour's treatment and go straight to work afterwards and carry on with an afternoon clinic. Simple painkillers which you can get over the counter are absolutely fine. What also I will say is that we do need to be patient for these results. Collagen takes time to work. It takes at least 30 days to start growing, and then at about 30 days, between 30 and 90 days, you'll start to see some slight tightening, some slight lifting. The results are very subtle, and because you look at yourself in the mirror on a daily basis, you may not see any results. It's only when you see your before and after pictures that you see, oh my God, that's truly amazing. Some of the results can look as good as surgery, but generally speaking, we don't say it's instead of surgery. It's if you don't want surgery, Ultherapy is the next best thing. A lot of questions we get asked is, does Ultherapy mean I won't need my Botox or fillers? Well, it does something different. Ultherapy gives a lift to the lower face and to the brow. If you're having Botox for a brow lift, I would suggest that Ultherapy may do a better job over time. So after a year or so, you might find you need less Botox treatments. So yes, in that instance, I think Ultherapy is the better option. But the difference is you don't get the immediate lift like you do with Botox. You have to wait a few months. So I would suggest in the first year, carry on with your Botox treatments for a brow lift. And then after the first year, reevaluate and see whether or not the Ultherapy is taken over. If you're looking for volume, it doesn't create volume. So if you have dermal fillers to create volume in your mid-face or in your temples or around your nasolabial fold or in your tear trough or on your lips, it's not going to improve that. It's going to lift, so you might find you need less filler because you don't need to use as much filler for lifting then, more just for focal volumization. Okay? It's not going to get rid of pigmentation, so you still need your depigmenting treatments such as sunscreen, such as any of the peels we offer at the clinic or even some of the lasers. So it's an extra treatment that is used in conjunction with your normal treatments, or if it's something that you just absolutely don't want any injectables, Ultherapy is there. Where I see it completely replacing is I see it replacing the radiofrequency treatments such as Pelave. It lasts longer, and is more cost effective for patients. Thank you very much for listening. I look forward to seeing you soon. Take care. Bye-bye.